If you're over 60, picture this. You go to bed after a healthy dinner, maybe a salad, some steamed vegetables, feeling proud of your choices. But by morning, something's wrong. Your words slur, your arm feels weak, or you wake up dizzy without warning. Most people assume strokes come from fried foods or sugar. But here's the shocking truth. Sometimes it's caused by a vegetable. Yes, an ordinary vegetable you've been told for years is heart-healthy and brain-boosting. But after 60, eaten at the wrong time or in the wrong way, it can quietly raise your stroke risk overnight. I've seen this countless times in my practice. Foods that protected your body at 40 can backfire at 70, especially when combined with common medications or eaten late in the evening. But here's the good news. You don't need to fear food. You need understanding. When you know how your aging body processes food differently, you can keep enjoying meals safely. I'm Dr. Daniel Lee, and I've spent over a decade as a practicing physician helping seniors just like you maintain independence, cognitive function, and cardiovascular health. I've worked with thousands of older adults who thought they were doing everything right, only to discover that small adjustments in timing and food combinations made all the difference. Today, I'm revealing 9 common vegetables that can quietly increase stroke risk if you're over 60. More importantly, I'll show you the exact timing strategies and safety guidelines that let you keep eating these foods without hidden dangers. Watch until the end. The last vegetable is one almost every senior eats weekly, and it may be the most dangerous when consumed at night. Let me know in the comments where you're watching from, and if you're new here, subscribe so you never miss health tips that could change your life. Now let's begin with a vegetable you probably thought was your best friend. Vegetable number 9, spinach. For decades, spinach has been celebrated as nature's perfect food. Packed with iron, magnesium, and antioxidants, it's been recommended by every health expert. And truthfully, spinach offers incredible benefits for younger adults. But after 60, this leafy green can shift from ally to risk if you're not careful. The reason is oxalates, natural compounds that bind to calcium. In younger people, kidneys flush them out efficiently. But as we age, 3 changes happen. Kidney function slows, blood vessels stiffen, and many seniors take calcium or vitamin D supplements. When these factors combine, oxalates and calcium form tiny crystals in your bloodstream. Think of fine sand building up in a narrow pipe. Over time, these crystals accumulate and narrow the arteries feeding your brain. Blood flow weakens, oxygen drops, and a small clot can trigger a silent stroke overnight. To stay safe, eat spinach earlier in the day, breakfast or lunch, when your metabolism is most active. Avoid pairing it frequently with calcium supplements at the same meal. If you have kidney or heart issues, discuss your spinach intake with your doctor. Spinach remains powerful, but after 60, it comes with rules. Follow them, and it protects you. Ignore them, and it may quietly work against your brain. 8. Broccoli. Broccoli has long been praised for cardiovascular health. Rich in fiber and antioxidants, it seems perfect for any senior's diet. And in many ways, it is. But there's a hidden complication most older adults never hear about. Broccoli contains high levels of vitamin K, essential for blood clotting. For younger people, that's beneficial. But for seniors taking blood thinners like warfarin, Plavix, or aspirin, too much vitamin K creates a dangerous imbalance. Your medication thins blood to prevent clots. Vitamin K promotes clotting. When you eat large amounts inconsistently, your medication levels swing unpredictably. Let me tell you about Margaret Chen, a 79-year-old retired librarian. After her cardiologist prescribed blood thinners, she ate broccoli every night, believing it would help her heart. Within weeks, her blood became dangerously thin. She bruised from the slightest touch and developed nosebleeds that wouldn't stop. One evening, she collapsed from internal bleeding. At the hospital, we discovered her blood thinner and high vitamin K intake had created a life-threatening imbalance. Margaret told me with tears, "I was just trying to be healthy. I had no idea broccoli could do this." The real danger isn't broccoli itself, it's inconsistency. To stay safe, keep your intake steady and moderate. Don't suddenly increase or decrease portions. Always inform your doctor about your regular diet so they can adjust medication appropriately. Broccoli can still protect your heart, but after 60, especially on blood thinners, eat it with balance, consistency, and medical awareness. Vegetable number 7, romaine lettuce. For countless seniors, a fresh salad at dinner feels ideal. Light, easy to digest, and gentle on the stomach. Romaine lettuce often takes center stage, crisp and refreshing. It seems harmless, but romaine eaten late in the evening can quietly increase stroke risk by morning. Here's why. Romaine acts as a natural diuretic, encouraging your body to release water. For younger adults, this is barely noticeable, but after 60, it becomes significant. 3 problems emerge with age. Kidney function slows, making fluid balance harder to regulate. Blood vessels lose flexibility, and your thirst signals weaken. You might not feel thirsty even when genuinely dehydrated. When you eat romaine at night, the diuretic effect continues while you sleep. Your body releases water without replacement. Blood volume drops and becomes thicker, almost syrupy. Thick blood moves sluggishly through aging arteries, making small clots far more likely. The solution isn't eliminating salads, it's timing. Enjoy romaine at lunch when you're actively hydrating and moving. If you eat greens in the evening, drink a full glass of water alongside them. If you're on blood pressure medications or diuretics, ask your doctor whether evening salads might intensify those effects. Romaine remains excellent for heart and digestive health, but after 60, timing is everything. Eaten wrong, it strains circulation overnight. Eaten right with hydration, it stays your ally. Vegetable number 6. Raw carrots. Carrots have always been the ultimate healthy snack. Crunchy, naturally sweet, and packed with beta-carotene for eyes. They're the guilt-free treat in every refrigerator. But for older adults, raw carrots at the wrong time create hidden circulation problems. Raw carrots digest quickly, releasing natural sugars into your bloodstream. In younger people, the body handles this efficiently. But in seniors with prediabetes, type 2 diabetes, or slower metabolism, that sugar surge triggers a dangerous reaction. Blood sugar spikes after eating raw carrots late evening. Then, as you sleep, it crashes. This overnight drop forces stress hormones like cortisol and adrenaline to surge, tightening blood vessels and raising blood pressure when your body should rest. Combined with nighttime dehydration, your blood becomes prone to clotting. I'll never forget David Patterson, a 74-year-old retired teacher. Every night, David snacked on raw carrot sticks, believing he was making smart choices, but he started waking up confused and dizzy. One morning, his wife found him unable to speak clearly. At the hospital, tests revealed a mild stroke. His blood work showed dramatic overnight blood sugar fluctuations and microclotting in brain vessels. David told me, "I thought I was being careful. I never imagined carrots could hurt me." The fix is straightforward. Avoid raw carrots alone at night. Enjoy them during the day when your body handles blood sugar better. Always pair them with protein or healthy fats, hummus, nuts, or yogurt to slow sugar absorption. Carrots remain fantastic nutrition sources. But after 60, timing and pairing make the difference between healing and harm. If this information is helpful, please hit the like button. It helps more seniors discover these insights. Subscribe to Senior Vital Health for videos that keep you strong, sharp, and independent. Drop a comment with your age, location, and how your health has been. I read every comment and love hearing your stories. Now, let's continue with 5 more vegetables requiring your attention after 60. Vegetable number 5. Garlic. Garlic has been treasured for centuries as nature's medicine. It lowers blood pressure, supports cardiovascular health, and strengthens immunity. Many seniors add raw garlic to meals or take supplements, believing they're boosting health naturally. But after 60, especially for those on blood thinners, garlic can cross from protection to danger. Garlic is a natural anticoagulant containing compounds that reduce clotting. Beneficial alone, but risky combined with warfarin, clopidogrel, or daily aspirin. When garlic and blood thinners combine, they can make blood too thin, leaving brain vessels vulnerable to bleeding. Results range from unusual bruising and nosebleeds to dizziness, fatigue, and hemorrhagic stroke. The solution isn't eliminating garlic, it's wise use. Skip concentrated supplements unless doctor approved, as these are far more potent than cooking amounts. Stick to small quantities in cooked meals. Cooking tames blood-thinning properties. Watch for warning signs, unexplained bruising, persistent headaches, unusual fatigue, or prolonged bleeding. If you notice these, talk to your doctor immediately about adjustments. Garlic remains powerful for health, but after 60, treat it with prescription-level respect. Used correctly in moderation, it strengthens your heart. Used carelessly alongside medications, it endangers your brain. Vegetable number 4. Onions. Onions are everywhere in cooking, adding flavor and aroma. Beyond taste, they're packed with antioxidants that lower cholesterol and fight inflammation. But for seniors over 60, especially those on blood pressure medications, onions can quietly create trouble. The key compound is quercetin, which naturally widens blood vessels to reduce blood pressure. In moderation, that's helpful. But when quercetin combines with prescription medications doing the same thing, the effect becomes too strong. Blood pressure drops too low, reducing oxygen to the brain and causing dizziness, confusion, or fainting. Overnight, when hydration decreases and blood flow slows, this combination creates perfect conditions for mild stroke or dangerous circulation drops. To stay safe, treat onions as flavor, not the main dish. Cook them instead of eating raw. Heat reduces quercetin intensity. Avoid heavy onion meals late evening when circulation naturally slows. Stay hydrated throughout the day. If you're on blood pressure medications, mention your onion consumption to your doctor. Onions remain incredible for healthy diets. But after 60, enjoy them with awareness. Moderate amounts cooked into daytime meals add benefits. Too much consumed raw at night strains circulation and risks your brain. Vegetable number 3, corn. For many seniors, corn feels like comfort food. Sweet corn on the cob, warm grits, or creamy chowder. It's familiar and satisfying. But here's the reality. Corn acts more like starch than vegetable in your body. When you eat corn, your system rapidly converts its sugars into glucose, spiking blood sugar like white bread. For seniors with slower insulin response, this creates a dangerous roller coaster. Blood sugar surges, then crashes hard. These crashes, especially during sleep, force stress hormones to surge, tightening vessels and thickening blood. This creates ideal conditions for overnight clots in brain arteries. The solution isn't banning corn, it's strategic eating. Avoid corn at night when your body is less active and vulnerable. Pair it with protein or healthy fats like beans, eggs, or avocado to slow absorption. Treat corn as occasional side dish, not daily staple. Choose fresh corn over processed versions like flakes or grits, which spike sugar faster. Corn may taste comforting, but after 60, your body treats it differently. With right timing and pairing, you can enjoy it without the hidden price of unstable blood sugar and stroke risk. Vegetable number 2, asparagus. Asparagus is seen as sophisticated and clean, frequently featured in healthy meal plans. It seems like the safest choice, especially for seniors avoiding heavy foods. But asparagus carries a hidden risk after 60. Asparagus is a natural diuretic, encouraging water release. For younger adults, this is barely noticeable. But for seniors, it can tip you into dangerous states, especially eaten late. By your 60s and 70s, critical changes occur. Kidneys don't regulate fluids efficiently. Thirst signals weaken. You don't feel thirsty even when needing water. Blood vessels become rigid, unable to adapt to volume changes. When asparagus pulls water from your bloodstream, blood volume reduces and becomes thicker. Thick blood moves sluggishly, dramatically increasing clot risk that blocks brain oxygen while you sleep. The fix is simple. Avoid asparagus late at night. Enjoy it at lunch or early dinner when you're actively hydrating. Drink water or eat hydrating foods like cucumbers alongside it. If you're on blood pressure or kidney medications, ask your doctor whether asparagus might intensify effects. Asparagus remains rich in vitamins and antioxidants, supporting healthy aging. But it requires timing after 60. Eat it early with hydration, and you keep benefits. Eat it late without thinking about fluids, and it may quietly increase stroke risk. Vegetable number 1, tomatoes. Tomatoes feel like the ultimate healthy eating symbol. Sliced in salads, simmered in sauces, or eaten fresh. They're light, refreshing, and packed with antioxidants like lycopene supporting heart health. But after 60, this beloved staple can create circulation and neurological problems mimicking stroke symptoms. Tomatoes belong to the nightshade family, containing compounds affecting aging bodies differently. First, they contain histamines and tyramines, natural compounds triggering inflammation, constricting vessels unpredictably, and interfering with nerve signaling. For aging brains and fragile vessels, this leads to dizziness, headaches, or numbness eerily similar to stroke warning signs. Second, tomatoes are highly acidic. Frequent consumption disrupts electrolyte balance by depleting calcium and magnesium, crucial for stable nerve function and muscle contractions. When these minerals drop, especially at night, blood pressure swings unpredictably and circulation disrupts during sleep. Let me share Robert Mills's story, an 81-year-old retired engineer who loved evening tomato soup. Every night for years, Robert heated a big bowl, believing it was light and healthy. But he started experiencing strange symptoms: morning dizziness, occasional finger numbness, mild confusion. One evening, Robert couldn't remember his granddaughter's name. His speech slurred and left arm felt weak. At the ER, doctors initially suspected stroke, but brain scans were clear. After testing, they discovered electrolyte imbalances and vascular inflammation directly linked to his nightly tomato diet combined with blood pressure medication. Robert recovered after adjusting habits but told me, "I never would have believed tomatoes could cause this." To stay safe, avoid heavy tomato meals before bed. Soups or large salads late evening can tip chemistry toward instability. Enjoy tomatoes earlier when your body processes effects better. Pair them with magnesium-rich foods like spinach or pumpkin seeds to balance acidity. Cook tomatoes gently. Heat reduces solanine while making lycopene more available. Pay attention to body signals. If you notice persistent dizziness, brain fog, or headaches after tomato-heavy meals, don't brush it off. Talk to your doctor about adjusting diet and checking electrolyte levels. Tomatoes can still be part of brain-healthy diets. But after 60, consume them in moderation, at right times, and balanced with nutrients supporting stable circulation. After hearing about these 9 vegetables and their hidden risks, it's natural to feel surprised or unsettled. We've been told our entire lives that vegetables are always good, and for the most part, that remains true. But what changes after 60 is how your body responds. Kidneys filter slower, making compound elimination harder. Blood vessels become thinner and more fragile. Hydration needs shift, while thirst signals weaken. And if you're taking medications, even subtle food interactions can tip the balance dangerously. That's why it's not just about what you eat anymore. After 60, it's about when, how much, and what else is happening in your body. A spinach salad at lunch may strengthen bones. That same salad at night with calcium supplements could contribute to arterial buildup. Garlic cooked into midday meals supports cardiovascular health. But garlic supplements alongside blood thinners can make blood dangerously thin. The truth is, you're not powerless. The more you understand your aging body, the more confident your food choices become. By making small intentional adjustments, staying aware of timing, maintaining hydration, understanding medication interactions, you can continue enjoying foods you love without fear. Because awareness isn't restricted. Awareness is freedom. What should you do with this information? 5 clear steps you can start today. First, simplify food choices. Focus on whole foods that don't cause dramatic swings in blood sugar, hydration, or blood pressure. Second, pay attention to meal timing. Diuretic vegetables like romaine and asparagus should be eaten earlier when you're actively hydrating. Foods affecting blood sugar like corn and raw carrots are safer at lunch than late at night. Third, stay consistently hydrated. Even 1 extra glass of water evening makes significant difference in blood flow and preventing overnight clotting. Don't wait for thirst. That signal weakens with age. Fourth, have honest doctor conversations. Share what you eat and when. Ask how medications might interact with common foods. Most doctors appreciate informed patients. Fifth, watch for warning signs. Morning dizziness, unexplained fatigue, unusual bruising, persistent headaches, or confusion aren't just normal aging. They're signals something needs adjustment. Listen and investigate with professional help. This video is for educational purposes only and never replaces professional medical advice. Always consult your doctor before making significant dietary changes. Working closely with your healthcare team is the safest path toward long-term health. Today, we've uncovered 9 common vegetables that can quietly raise stroke risk when eaten wrong after 60. From spinach and broccoli to asparagus and tomatoes. But understand this, these foods aren't enemies. When eaten at the right time, in moderate amounts, with awareness of medications and hydration, these vegetables can still protect your brain, strengthen your heart, and support vitality well into your 70s, 80s, and beyond. Now I'd love to hear from you. Which vegetable surprised you most? Will you change how or when you eat them? Drop your answer in the comments. Your story could help another senior watching right now. If you found this helpful, please like this video, subscribe to Senior Vital Health, and click the notification bell. I'm Dr. Daniel Lee, and I'll see you in the next video.